of the new FSA. The fear is gone. We did this presentation last week to a packed house, and I pretended to be Ron Popeil of Ronco Kitchen Products when I started the presentation. You remember Ron Popeil and the kitchen rotisserie? You set it and forget it. Well, I said they should think of that, and I'm Ron Popeil, but every time I say the new FSA, they're supposed to think or say, they said it, we'll ask you to think it, the fear is gone. So in your mind, when I say the new FSA, I can feel that energy out there going, the fear is gone. Now, before I get into the talk, I do want to take a moment to mention our save the date that we have on the bottom of the slide. We're extremely excited that we're celebrating our 20th anniversary, and we wanted to put the save the date on there. We have some activities going on. We're having a lot of fun here at the office, but the most important thing that the 20th anniversary brings to mind is the fact that we need to thank you for being our clients and working with us, because having you work with us allows us to have the success that we're enjoying. So everybody should save the date. If you can get in for our open house, you're all invited. Invites are going to go out. And it's just important that you know, without you, it wouldn't be happening. So today I'm here to talk regarding the $500 carryover. As I had said before when I asked you, that would let you know we're starting in a minute, that this is Mark Smershel. I am CFC, Certified in Flexible Compensation, by the national organization, the Employers Council of Flexible Compensation. And today I'm joined by many Beneflex members, but the ones that you'll probably hear from would be Brenda Cox, our operations manager, Jennifer Shaw, our processing manager, and then Judy Coleman, our sales and consulting manager, and they'll jump in as needed as we go through the questions and through your submissions. So we felt a need to revisit the $500 carryover again, thanks to the IRS waiting for the absolute craziest, busiest time of the year to make this announcement last October 31, 2014. Now, I do want to mention that some of the topics I'm going to cover are receiving a great deal of press. For example, the pre-tax individual health insurance premium, and employers are out there going, should I, shouldn't I, and everyone has an opinion, but this is one of the hottest topics that we have going right now. I just returned from a week in Denver where I was attending the Employers Council on Flexible Compensation, and we spent a great deal of time discussing the positions and putting together the facts on the guidance, and we're going to be submitting that out to you all in short fashion, either the end of this week or next week. But when it's all said and done, you know, the important thing is gathering the facts, attending webinars like this as you are, but, you know, talking with your insurance brokers, talking with your benefits attorney, because there's a lot going on with the Affordable Care Act. So today's highlights, we're going to revisit the impact of health care reform on pre-tax benefits. We're going to review in depth what the new FSA changes mean for your business. After we discuss the impact and your options, we're going to touch on HSAs, parking and transportation plans, the needs of those plans, and the cost of living adjustments. And then we'll end up with questions like we always do, because we want to hear from you to make sure that we answer your questions. Now, when the carryover was announced, we did a webinar immediately last year, but many employers couldn't consider the carryover. It was too late in their renewal process. So, and to be fair to their employees, they held off instead of making that change. Now, we did have 100 clients, give or take a few, that did sign up for the carryover. They were starting it later, they had been anticipating, whatever the reason, and we've got 100 happy clients out there right now that did the election. That's slowly been adding and adding as the time's going along, and we kept hearing from our employers that they'd like to see us revisit the subject today. So the carryover is something that's going to help a lot of employees, and today we're going to talk about the Health FSA $500 carryover, and carryover is the official name. Many people also refer to it as a rollover, but no matter how we say it, we're all referring to the same thing, the new FSA. The fear is gone. And I promise you, I'm only going to have you think that in your mind about a dozen more times. This all originated back on Friday, September the 13th. What a surprise. The Treasury published Notice 2013-54, which preserves all HealthFlex spending accounts that are considered accepted benefits, but eliminates an employer's ability to use a standalone FSA or other tax-favored arrangements, including health reimbursement arrangements or premium-only plans, to help employees pay premiums for individual health insurance policies on a tax-free basis. Now, the good news, if you have an off-plan year and you are doing this, you're allowed to continue to pay the employee's individual health insurance pre-tax until that benefit plan renews. The bad news, that clock is ticking. So 2013-54 had some major impacts, especially on the health reimbursement arrangements. Standalone HRAs for any Section 213 expenses are no longer permitted. Now, this is review for a lot of you, but it's such a hot topic still. We're making sure that we're all understanding how this works. For an employer to have an HRA, it must be integrated with an employer's group health plan. By now, everyone should know that the spend down of the plan, HRA plans that you did have is permitted for those existing standalone medical HRAs, and that spend down can continue until those funds are gone. And HRAs are no longer allowed to reimburse premiums for individual insurance policies. Now, 2013-54 did leave retirement HRAs alone, so we won't go into them now. But if you do need to discuss them, we administer a lot of retirement HRAs. Please give us a call. But we're going to focus our time more on things that did change. Now, you would think this HRA change, 2013-54, would have hurt the HRAs for employers. But to tell you the truth, we had more HRAs help employers in 2014 than we did last year. Our HRA volume actually increased. And we look for the HRAs to keep growing since the government repealed the cap on small business deductibles. The ACA had said that small groups were capped at deductibles of $2,000, $4,000, but the good news is that's been repealed. So those qualified high-deductible HRA plans are still very much a great affordable health insurance solution to help you give the best benefits to your employees and to help keep them affordable. Prior to this guidance, assuring a health FSA was classified as an accepted benefit for purposes of HIPAA was important for two primary reasons. One, so COBRA continuation was not offered when the account was overspent, and two, to avoid HIPAA portability requirements. But now, in addition to assuring health FSAs are swept into the W-2 reporting rules, FSA plans must also meet HIPAA accepted benefit rules to be offered in compliance with the Affordable Care Act requirements. Generally, this means health FSAs must meet two conditions to be offered. One, only individuals eligible for employer-provided major medical coverage can be offered health FSA. And two, employers with health FSAs must have an underlying group health insurance plan. Now, the third thing there that we don't list is if you don't have a health insurance plan, you can still offer dependent care, but let's focus on the health FSAs. Now, Beneflex normally advises employers when they set up their plan documents to only offer FSAs to those eligible for health insurance. An amendment will be required for any company's plan document if you don't have your plan set up that way. So employees are FSA eligible if they are eligible for the company health insurance. Employees don't have to enroll in the health insurance, they have to be eligible. So if the employees are eligible, but they don't enroll, they can be in the plan. In addition, the health FSA must limit the maximum payable to 2 times the participant's salary reduction, or if greater, the participant's salary reduction plus $500. Now, what does that mean? I think it's a legal jargon way, a fancy way of saying that health FSAs can include employers' contributions of up to $500. But remember, FSA employer contributions are capped at $500 unless the employer is doing a dollar-for-dollar match of each participant's election up to $2,500. The 90-day waiting period, health plan years beginning on or after January 1, 2015 may not contain a waiting period for entering in the plan that exceeds 90 days. That's 60 days currently in California, plus other states may vary. But the waiting period, and that's something a lot of people aren't familiar with, there's a waiting period that can include an additional 30-day orientation period. So 90 days is the waiting period for the health plan, effective 2015. Now 90 days is also the rule in order for the health FSA to retain its status as an accepted benefit. It can only be made available to employees who are eligible, also eligible for an underlying health coverage plan. Health FSAs must ensure that their waiting period is no less than underlying health coverage, so employers should be sure that their waiting period for their premium only in the health FSA portion of the employer's cafeteria plan mirrors the waiting period for the underlying health insurance plan. Now, in the case of dependent care, DCAP, the waiting period is not set. There's a lot of flexibility there, and you can keep your DCAP however you want it to be, but we recommend to match it up to the health FSA. You have enough deadlines and everything that you have to remember already for your benefit plans. Let's make them all consistent. The waiting period for the health FSA that cannot be shorter than the waiting period for the employer's group health insurance plan. If the cafeteria doc plan doesn't currently reflect these terms, an amendment to the cafeteria plan can be adopted that states the eligibility and entry data into the cafeteria plan are the same as the underlying health insurance plan. This ensures no disconnect to waiting period changes in the health insurance. If Beneflex administers your plan, contact us if you need to discuss these changes. And if we don't administer your plan, contact us and we can discuss making these changes and doing your plan administration. So after everything I've covered, this slide has one purpose and one purpose only. It's to remind you of a possible amendment action or action steps that you're going to need to take. The possible amendment actions that we've discussed so far might be the health FSA. It might be for your premium only plan. You may prefer to amend your plan to adjust the waiting period to coincide with the eligibility for the employer's group health plan, but definitely you need to be sure your plan does not exceed 90 days. And I want to take 1 second there because the clarification for California, and I saw a number of our clients, a good number of you have come on. Thank you for joining us. The ACA says you can't have a waiting period greater than 90 days. but it also says each state can have their own say as long as it's not more than 90 days. California chose 60 days, but let's pay attention to this because there's some language in a bill that's on the table to have that changed to 90 days come January 1, 2015. And from what we've heard in following this, there's a lot of support and it's expected to pass. It hasn't passed yet, but let's follow that. And when we do that final notification, we'll send out a Benny blast to everyone letting them know that it's happened. So the new FSA, everybody in your mind, the fear is gone. What a long, long journey. The FSA rule has been in place for 3 decades. That's right. Most of us were not around, or we were babies when this all started. The carryover is great news, but it's not a complete surprise. For the past 3 years, Beneflex, the Employers Council on Flexible Compensation, and many other groups lobbied the IRS and encouraged them to modify the use it or lose it. This combined with everybody out there listening that used our partner website, SaveMyFSA.com, played a big part in making this happen. This was a true industry effort. Now, hysterically, or historically, depending on the context, the use it or lose it started out with the IRS being afraid that employees would hide buckets and buckets of money tax-free. So I guess it was hysterically. And it's been that way for a long time, and it wasn't until 2005, after significant public pressure, that the IRS made a change and adopted the grace period. The grace period was optional, as is the carryover, but the grace period was brought into play with Notice 2005-42. And I tell you, I can't believe it was 9 years ago, I was on a webinar doing these presentations talking about how the grace period would work, how would it impact your employees, and what a great opportunity it was. Well, the Affordable Care Act came out, and that brought with it the $2,500 limit on salary reductions for the FSA. Now, everybody said, wait an FSA minute. If we've got a limit now on our FSA contributions, you, the IRS, cannot be worried about employees hiding large amounts of tax-free money. So the IRS solicited input with Notice 2012-3, and they received an overwhelming majority of comments that favored modification. And as Gomer Pyle would say, surprise, surprise. And that input from everybody on the modification led us to the October 31st government treat, and for once it was a treat when we finally got our carryover. So thanks to all of you that played a part in doing the work that helped this carryover Notice 2013-71 be passed. And by the way, mark your calendars, starting next year, a new lobbying effort is going to be started when we start to go after a lobby to exclude the FSA from the Cadillac tax from 2018. But that's going to be another webinar. So we need to talk about what the impact is of choosing carryover over the grace period. Let's focus on 2014 right now, because you need to make a decision as daylight's burning, and this plan year is going to be over before you know it. So let's currently say you don't have either the grace period or the carryover. If you make a change to add one, it must be announced before the end of the plan year, and you must amend your plan before the end of the plan year. If you currently have a grace period and you want to change to the carryover, of course, we need to announce that as soon as possible. Education is going to be key to the success of the change from the grace period to the carryover, but you must amend the plan before the end of the plan year to eliminate the grace period in 2014. If you amend to the carryover, You can do that anytime up to December 31st, 2014. Now that last little bullet there, you might have to address any non-code legal constraints. If you're going to make this change for carryover in 2014, we want to talk about the pros and the cons, because you have employees that could be upset if they lose some money in the FSA at the end of the year because they have more than $500 because they thought they still had the grace period. So let's review. And I review because, as I said, 9 years ago I did this webinar on the grace period. And a grace period following the end of the plan year, which usually which unused benefits or contributions are remaining at the end of the plan year, may be used for qualified expenses incurred during the grace period. So the key of those last words there, incurred during the grace period. And remember, the grace period is very different from the FSA runout. The FSA runout is that period at the end of your plan year that employees have to submit expenses they already incurred during the plan year so they can get reimbursed before the runout is done, normally 90 days. But the grace period allows employees additional time to incur expenses, and normally the runout runs concurrently with the grace period. So your grace period is 2.5 months, your runout is 3 months. By having a grace period, you're giving them an additional 2.5 months to incur expenses, and then they have to submit for reimbursement. So the grace period is 2.5 months, or up to 75 days if you're off plan year. There's no limit on those funds that can roll over in the grace period. Does not reduce the $2,500 salary election amount an employee could do the next plan year. It must be uniformly available, and Beneflix does not recommend the grace period for dependent care. It can cause an employer, if you have the grace period in for dependent care, it can cause the employer extra tax reporting responsibilities if there are certain situations that come into play. And two, actually DCAP's a lot more friendly in terms of the change of status rules, and I'm going to discuss that more on this next slide. Now to review the carryover 2013-71, since we just went over all of the benefits of the grace period. The 2013-71, it is also an optional adoption of a plan, and this is a $500 carryover of a health FSA, not DCAP. Remember, there's no change in DCAP, and the reason for that, the reason the DCAP isn't included is it's not a problem. It's so easy to change your dependent care election, because if your daycare needs change or your daycare expenses change, you can change those elections during the year. So for the health FSA, those change in status rules, they're a little tighter. So that's why DCAP isn't included in this $500 carryover. So the health FSA $500 carryover, it does not reduce your $2,500 salary reduction amount. Meaning if you carry over the $500, you can do a full $2,500 election the next year. The carryover must be uniformly available, just like the grace period. Everyone has to have the $500 carryover, or no one has it. Everyone has to have the grace period, no one has it. So there's a lot of equal things. So the most important thing is you can't let your employees pick and choose, but the main difference is the 2.5 months versus the rollover from year to year to year. And so should you do the carryover for 2014? We believe it's a huge opportunity for employees. There's no more fear of use it or lose it. Everyone should participate, even your invincibles, those young, healthy guys or gals have those unknown out-of-pocket expenses. You know, when we do the meetings, they're always, I'm not sick, I'm always healthy. Well, you know, why wouldn't those invincibles put 500 FSA just-in-case dollars into the FSA with a carryover in case they do have those just-in-case medical expenses? You know, with the carryover, there's no rush for spending at the end of the plan year. You need to monitor your account, you know, the way you do currently. It's just instead of monitoring to get it down to 0, you would monitor to make sure you at least have 500 or less, but there's no rush for spending. You know, that $500 is going to be a huge cushion, and in addition to that, it's going to drive participation to a higher level. It's a big opportunity for employers to enhance this benefit. It's exciting, it's simple, it's a great benefit, simple for the employees to use because there's no fear of use it or lose it. It increases plan flexibility. There's low or no plan administration costs due to FICA savings, and widespread participation in the FSA, which is what we think the carryover will drive, equals widespread increased satisfaction with your employee population. Now, we've been looking at this for quite a while, and we've analyzed some details from our current FSA account balance reports. On average, at the end of the plan year, most companies have 15–20% of employees with a $500 balance or more in their accounts. Now, that statistic seems a little high to me because I knew I blew through my 2,500 by June of this year. That's what, you know, those reporting analysis said to us. But you have to remember that analysis we did was done on accounts that are used to and are using the grace period. So the grace period rules allow you to have more than 500. So we have come to a conclusion that's why there is that 15 to 20% that has 500 or more there. Now, we suggest, and again, it's your decision to make, we suggest starting to carry over in 214, but spread the word now so employees can use their 214 funds and can maximize those elections for 215. Most importantly, by announcing it now, you have a much greater opportunity of bringing in a lot of new participants for the FSA plan. So thinking ahead, we've revisited our FSA enrollment kit for employers and employees, and we've added some optional new educational materials to make for a smooth transition. Now, we already had grace period materials, but if you announce in 214, excuse me, if you announce in 214 the carryover, we started creating a lot of additional materials, and we can send those supporting materials for you to distribute. So let's take a look at both of these flyers that are available for you to see. The flyers, we met with a lot of those young invincibles. We have some in Beneflex. We have some in our sister accounting firms, Commercial Talor. But we met and we sat down with them. You know, they're the guys that go out biking or mountain climbing, or they're out surfing over the weekend, a lot of surfing here in the Midwest. But so they're out there having a good time, and we sat down and got the standard answer, I'm healthy. I don't have any medical expenses. So by putting the eligibility list in front of them, you know, talking it through, they did get sick once a year. You know, it doesn't seem like much. Once a year, I'd be ecstatic to get sick once a year. So, you know, they had a copay. They did go to the dentist once a year. You know, they had a spouse that got a vision exam. And, you know, in stepping through that, and these are just individual small things you know, and they're out there doing that mountain climbing, and they needed some Motrin and Tylenol for the next morning because they're a little sore. They did catch a cold, glasses. They got an antibiotic when they got sick. You know, when it's all said and done, these are just individual things that they said, yeah, that happens once a year. And, you know, you look down there and they're like, first aid kit. Well, they're mountain climbing. They got to have a first aid kit. But when it's all said and done, very quickly with that group that said, I don't have any medical expenses, they saw, and we put together this flyer and took it back to the others. They were like, well, yeah, that's me. That's realistic in a year. I could have $500 in expenses. And then when you shared that came along with 152 average tax savings, they were very excited when you combine that with an FSA with a carryover. There's no risk to them, and they could visualize in their mind through this flyer how they might actually have $500 in expenses. So after that flyer was put together, we created a letter to go along with it. Again, these are optional materials. We can personalize them for your company or for your clients. But you know, it's to the participant telling them how the FSA is available with a carryover, that what it means for them, they should do next. You know, if they're still hesitant, it leads them to our website. So we felt it was a good second piece to have together for them going forward, and it allowed them to consider it in an early fashion. So earlier I had said the plan amendment has to include the carryover. Got to get rid of the grace period. And we want you to know we're ready. We have a flexible spending account set up and ready to go with educational materials. We have a staff, customer service. We have the employer portal. We're ready to do your FSAs. We have the summary material modifications, yada, 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 blah, blah, blah. The bottom line is, right now, we can do your plan amendment, your SPD, get that summary material modification together, and send you the education pieces and start to work with you on a timeline, if you choose to do this, to announce, to educate, to transition, and do everything starting sooner to help facilitate a smooth renewal period for the 2015 FSA. So kind of as a summation of, I covered a lot of things here, we created this flow chart on options and implications for employers who are considering grace period versus carryover. One of the options can be applied, only one of the options can be applied to a given year. A switch to or addition of a carryover or grace period requires a plan amendment, plain and simple. So the first thing to consider is decide on grace period versus carryover, one or the other. Can't do both. And when you do that and you're in that process, contact us, because we've been working with a lot of employers, a lot of brokers for their clients to pull together reporting out of our system on how their current FSA is running. You should look and see how many people are forfeiting funds, how many people have 500 at the end of the year. More importantly, how many do you have participating versus the number that could be participating, because we think your participation numbers with a carryover are going to skyrocket. A carryover option can be implemented now for the 2000, but 2014 employees may have made their elections based on the grace period. So the second action step is decide on that time frame. Let's get a timeline together, when we're going to announce it, when we're going to roll out education pieces. Let us help you personalize it for that change if you're going to do the carryover. The carryover will lead you to fewer forfeitures, higher re-enrollments. It will increase participation, election amounts. So that third point, and I can't stress this enough, and my entire team is behind me on this. We have a big meeting when this was announced, education is the key to success. Let us help you to educate. The main advantage in choosing the carryover for 214 and dropping the grace period, if you decide to do it, would be carryover duration is not limited. I gave you that side-by-side comparison, and the main feature is that rollover, which takes away the fear of use it or lose it. It keeps rolling from year to year. Using our FSA experience as a barometer, or maybe I should say flexometer, we feel confident once the $500 carryover is in place, employers will see their employees making larger elections. In the example above on the slide, if you have $1,000 in medical expenses you know you're going to incur, why wouldn't you add another $500 to save the taxes? Put it into the FSA in case you needed it. If it's not needed, it could carry over. It would be a higher election amount, and it would be an extra $500 for those unexpected medical expenses. It's there. It rolls over. You're in good shape, but the real added benefit to having that wiggle room in case you have more expenses is the extra $150 on average for tax savings for the employees. If you take that times a company with 100 employees, that's $15,000 in employee tax savings, and the employer using those same numbers is going to save $3,825 in FICA tax. And that's only using the FSA, the $500 carryover. I guarantee people are going to go beyond that quickly because once you're in a plan, you love it and you learn to use it. Some employers have said, you know, Mark, I'm concerned. We use those forfeitures to pay for the program. Trust me, the added FICA savings from getting all these new participants in the plan will do that and more. So let's take a second and talk about some administrative considerations. You know, because, okay, this is great in concept. Well, you know, what's it going to take to get this done? There must be something hiding behind all this good news that you're not sharing with us. Well, the answer to that is nope. It is what it is. We haven't seen that downside. We haven't heard back from anybody on the downside. You know, the actual carryover must be the carryover amount. Your carryover balance, Beneflex will coordinate that with your runout. It's important that you understand that the carryover is indefinite. Unless an employee terminates, that carryover will be there. The carryover doesn't double, triple every time. It's that same $500. And it's something that it can be capped at less than $500, but we scratch our head and say, why would you want to do that? This is a real opportunity to make the FSA a much more friendlier, usable FSA so employees can maximize their benefits. And the best news, are you ready for this? I guess I did hold something back. I, Mark Smershel, am no longer going to be known as that use it or lose it guy. Judy, Brenda, Jennifer, all the Beneflex employees are no longer here to take employees' FSA money. With the new FSA, say it with me, the fear is gone. So, back to the compliance. The carryover creates some potential impact on HSA eligibility. If you're considering HSA, if you have an HSA, this slide and the next one were made just for you. Under Internal Revenue Code 223, individuals with non-accepted health coverage are not HSA eligible. Carryover would generally preclude HSA eligibility if you're in a health FSA. For example, like the grace period, this is currently in place. If you're going to an HSA, and if you have the grace period, you have to have all money. That's right. Any money at the end of the year, if there's money left in that account, you're not going to be able to have an HSA until the first of the month following your grace period. 1 penny and I'm just telling you the rules, don't kill the messenger, 1 penny in a grace period stops you from starting to contribute to your HSA until the end of that grace period for the first of the month following. So if the grace period ends March 15th as an example, you would not be able to open an HSA account until April 1st if you had money left over and you had the grace period in place. So let's apply that to the carryover. With the carryover, it's for the entire year. So if you're looking at moving to an HSA, 1, most importantly, talk to Beneflex. We do great HSAs. But 2, make sure you educate your employees now that if you have the grace period, they have to spend all that money by the end of the year so they can get into the HSA on January 1. Because if you put the carryover in place, this is for the entire year. You need to educate them to spend down to 0 so there's no carryover, and then they can get into the HSA. Now that I've got your attention, there's some good news. Some additional guidance has been passed that allows some carryover workarounds. And these are just for the carryover. Don't confuse these with the grace period. If the employer offers a limited purpose FSA, then a participant may elect to carry over their funds up to $500 into that limited FSA. Also, a cafeteria plan that offers both a general purpose FSA and a limited FSA may treat an individual who elects to open an HSA as automatically opting to carry over their remaining balance into the limited FSA. And finally, if those two weren't good enough, they added an option that an individual may waive the carryover for the following year, so they may continue to start contributing in an HSA. I said that wrong. So they may begin contributing to an HSA. Now, as I said, you don't have that flexibility with the grace period. I'm not down in the grace period. I'm just giving you the facts so you can compare apples to apples. And if I may, the carryover should cause many employers with an HSA to take another look at the limited FSA. Because remember, the purpose of an HSA is in the name. It's a health savings account. Yes, everyone should pay for any medical expenses pre-tax, but the more you save in your HSA, the more it grows and it's there for you. So if you have that limited FSA in place for those dental and vision expenses, people can pay for those items pre-tax and not tap their HSA. But it's hard to predict those dental or vision problems. Now with the carryover, using a limited FSA, you can pay for those unexpected medical expenses, leave as much in your HSA so it continues to grow, but you're doing it all pre-tax. Carryover is only available for active individuals in the plan on the last day of the plan year. Even if an election is not made by the employees in the following plan year, the carryover is available. It is considered an automatic election in the new plan year for carryover purposes. Now, of course, all this legal walkthrough I'm giving you is because we're now considering COBRA, and we need to discuss the employees that elected to continue their FSA benefit under COBRA. Since all COBRA participants are considered to be active participants under the plan, they would be able to benefit from the carryover. Since COBRA for the FSA plan does not allow the COBRA participants to make additional elections after the end of the plan year, they would only have access to the carryover funds through the plan year in which they were carried forward. There would be no COBRA premiums associated with the carryover amounts that's rolling forward for that year, as contributions would have been paid during the prior plan year. Some more reasons to start an FSA with the carryover. New employees are going to love our mobile app. The app allows employees to check their available balances, view account activity, review claims transactions, contributions, access convenient customer service contact info, submit claims, upload receipts using the camera device. So if you take a second to look at this, your employees are getting app wiser all the time. When they get a notice that a card swipe requires an extra adjudication, they're using their phone, going to the app, clicking a picture of the receipt, and sending it in. So the phone app has been wonderful and has been taken over as the go-to resource for a lot of people for checking all the balance and submitting claims. In addition to that, we added a slide that talks about the app. And this is a buck slip that goes out with every new card to help educate and to lead your employees to higher satisfaction with their FSA by hopefully driving them to the FSA app. We've seen good growth with the app. More people are downloading from Android and Apple all the time. It's so simple to do. The buck slip that I just showed you had 3 steps it took to load the Beneflex FSA app. So our improvements are not just FSA focused. We are powering a complete solution for the flex spending account, the health reimbursement arrangement, the health savings account, and our transportation management accounts. We've got a consumer portals that were just updated. The employees, we've gotten a lot of positive feedback. The apps we talked about, the cards are smart cards. They're working in your favor. And our communications, you keep giving us good feedback, which allows us to improve and to develop communication pieces that meet your needs. And soon to be released, either this week or next week, the IVR is going to be reintroduced with Spanish and English. And I would expect to see a Benny Blast going out on that soon. So a little housekeeping as I start to wrap up. I promised you I'd talk about HSAs and transportation. The monthly limits on the amounts that may be excluded pre-tax for an employee's income for qualified parking benefits is $250 for 2014. The next year hasn't been released yet. That was a $5 increase over last year. A little bad news, the combined monthly limit for transit passes and van pooling expenses for 2014 was taken down to $130. That's a $115 decrease from the year before. Now, I want to make a note. That substantial decrease is the combined monthly limit for the transit passes and van pooling expenses. The reason that happened is there was an expiration of the rule of parity law. All we need is for Congress to get their act together. Don't hold your breath. And we will hopefully get that back. We'd like to see that sooner rather than later because we've gotten a lot of feedback from our transportation management accounts. The employees have been saying that they need more money for their public transportation. You know, it's kind of funny. We're working so hard to be this green country, but there's more incentive for you to drive and park at work than there is for you to take public transportation. I do want to make an announcement here. The FSA COLAs, since we're talking about cost of living adjustments, have not been announced or put in place for 2015. So currently we're still working with the $2,500 medical health limit for the FSA. And I know that we have a number of San Francisco Bay Area clients on the call. So I specifically added a slide for you because I wanted to remind you, and I'm sure you're all on top of this, but if you're an employer with 50 or more full-time employees in the Bay Area, and there are 9 counties that are affected by that, call us if you need to know if you're one of them. There is a mandate. You have to have a pre-tax benefit in place for transportation, for public transportation. The deadline to get that done is September 30th of 2014. Beneflex can help you do this program. It's a great incentive because the employees are going to save their 30% like they do in the FSA on taxes, the money they put in, and the employer also saves those FICA dollars. How do you do this? Just contact Beneflex. We have been doing a lot of setup out in San Francisco for this mandated transportation pre-tax program, and September 30th is coming soon, so please, please act soon and quickly. To touch on the HSA 2015 limits, the cost of living adjustments have been released. We have them going up. The HSA contribution will increase from 2014 to 2015 by $50 for single, $100 for family. From 14 to 15, the minimum deductible increased $50 for single, $100 for family, and the out-of-pocket maximum for 2014 went up $100 for the single and family, and single in 2015, and $200 for the family. And I want to take a second to thank all my HSA employers that are out there that have been using Beneflex. We've had a lot of great growth. The HSA has been working well for you, if that's right for your employee culture. And you know, it isn't that all HSAs are alike. The difference that we found is education and support for the employees helps to drive that success of an HSA. So thank you for bringing your HSAs to us. That combined with our smart card, because not all HSAs have a smart card that only allow medical coded MasterCard and Visa terminals. And the reason we feel that's so important is the employees have to do their own self-adjudication. So by having that smart card, it kind of drives them to use the card for the right qualified expenses. The new FSA, think it, the fear is gone. The FSA option, we strongly believe, really changes everything. We're very, very excited about it. You know, there's a standing industry statistic that says 80% of employees that decline the FSA did it due to the use it or lose it rule. Employees sent in a survey when we asked them, asking why they didn't get in the plan. They said the #1 reason was the use it or lose it rule. This fixes that problem. Everyone should be able to do a 500 minimum FSA, and because this is taken over and done so well, we've renamed the old use it or lose it rule. It's now the new FSA use it or roll over rule of $500. Some ways that Beneflex can help you. We can send out comprehensive reports and updates on compliance. You can go to our resource center on our website. There's no charge for this carryover plan amendment. We have sample employee communications ready to go. You can consult with our sales and customer service team. We have the technology in place and processing available right now to help you choose and make that plan change. To make that change for the carryover, you're going to, or if you decide you want to add the grace period, you don't have that in place, you're going to send your request to salesassist@beneflexhr.com. If you want to do this for 2/14, we will send you the amendment checklist, the paperwork you need to fill out right away, because as we said, that clock is ticking, and we have a lot of accounts coming in to do this, a lot of accounts coming in to do transportation. Our operations team is hammering these, putting these together as quick as possible, but the sooner you get them to us, the better the turnaround will be. So it's important that we take these actions now. So at this time, you can submit any questions, and the way you'll do that is you go up and you'll click on the question in the question box. You'll type in your question, and it'll be submitted to us. We are going to do our best to get to as many questions as we can. We had promised that this would be an hour, and I'm right at an hour, so we're going to get to them. And while you're submitting those questions, I do want to mention you're going to receive an email survey at the end of this webinar, and we would appreciate your feedback, you telling us that it met your needs, where we could have done something else. You're tired of hearing Mark talk, put Judy on the phone. Any of those inputs are things that we want to hear from you. In that survey, there will also be a link to these slides electronically. If you signed up in advance, you should have received all these slides already, but we want to make sure that if you need them again, that they are available. Brenda and I are going to walk through these questions together. Please stay with us as long as you can. We're going to keep it as brief as possible, but I think, Brenda, you're going to take the first one.
Yes, Mark. It says when someone has submitted a question that says, what if you have over $500 left at the end of the year? Do you lose the difference? And that is correct. The guidelines only allow for $500 to be carried over with this option. So if someone has a total of $600 left, they would be forfeiting that $100, but that's minimal compared to losing the full amount.
And I'll take that next question because I love it, Brenda. What deal is there if employees are already electing $2,500 and they're maxing out early in the year? Because that question describes me to a T. The deal is I need to get healthier. Unfortunately, they've still kept it capped at $2,500. There's been some language in some bills floating around to possibly repeal the $2,500 or to take it up more, but that's all discussion. So right now, the real major benefit for the carryover is bringing in all these people that don't participate, because if 80% are not participating, look at all the employees you could help out by bringing them in by eliminating their number one obstacle, which is the fear of use it or lose it.
Mark, we have a question from Kathy, and she just wants us to clarify that if they want to choose the $500 carryover, that they must cancel the grace period before implementing this option. And yes, Kathy, that is correct. One of the key things is to make sure that you, again, educate your employees, the participants, so that they understand the funds they used to use in the grace period will no longer be available. However, they have that great option now of being able to carry over the $500 into the next plan year.
Now, Carol asked an interesting question, and she wants to know, what if you're running dual FSA plans? They've got two FSA plans in place, and one has an HSA tied to it and the other does not. Could they offer the carryover option to those not under the HSA? You could establish your plan that way, Carol, but with all of the wiggle room and workarounds that they gave you for the carryover, I would strongly consider, putting the carryover in place for both the main FSA and for that limited FSA. I mean, they can reject the carryover. It can automatically slide into a limited FSA. So your employees will be protected. And if you want to discuss that more, I know Judy was actually on the phone yesterday talking with a client that had that same type of question. And after they walked through the concerns and the questions, they were very comfortable with offering the carryover to both plans.
Here's an interesting question as well. If the employee contributes in 2014 and carries over $500 to 2015, they do not make a new election in the 2015 plan, and they do not use any of the carryover funds in 2015. Can they carry over the $500 again to expenses of 2016? And yet the answer is yes. They can carry over multiple years. So that there again reassures the employee they are not going to lose that $500 fund.
And if I could add to that, Brenda, we've had a lot of discussions with, especially at the Employers Council on Flexible Compensation. We think if that is, that can happen. By law, it can happen. But we think that's going to be such a small portion of participants in the FSA that it'll be the exception and not the rule. Because doing this for as many years as I have, and I'm sure a lot of you will agree, once you get into an FSA, it works, and you understand it, and you just look for ways to use that money. But yeah, the law, and you do want that law in place. You want that safety net for that 80% of the people that say, I'm not doing it because of use it or lose it. If you said it was only for 1 year, well then use it or lose it is still there. By having use it or lose it completely gone, that eliminates the fear. But again, we think anybody that would carry over 2 years, 3 years, that will be quite an exception to the rule.
Here we have a question that's asking, do FSA overspends on separated employees need to be accounted for on W-2 reporting? You have to keep in mind that the employee has access to their full annual election for the medical care spending account on day one. Should they terminate within the plan year, you would not be able to tax them on that overspend on their W-2. But also keep in mind that there's always individuals that may terminate that are underspent, and therefore those offset each other throughout the plan year.
The next question is from Carol, and it says, are there any considerations for HSA plans? And I'm not quite sure what the question means, but I think what she's asking is the carryover available for the HSA. And if that's the question, a carryover is not needed for the HSA because those are the employee's funds. They stay in that account, they earn interest, and when the employee, if they decide to terminate the HSA plan or they terminate with you, employment with you, it's their account. Those funds are portable. That stays with them. So a carryover isn't required for an HSA, but the carryover for the FSA had HSA implications, and we covered that it works to our advantage.
Yes, I have a question here, Mark, asking, is there a fee associated with this change for the carryover? And no, there is no fee if the change is made in 2014 or if it's made at your renewal.
All right, and here's a question that we get quite a bit, not having to do with the carryover. It's just the standard FSA 125 tax code. The question is, can FSA overspend be deducted from final paycheck in the case of termination or leaving employment? And the 125 tax code has always said an employer cannot take that overspend and deduct it from the employee's final check. That's always been there, and this carryover has no impact on that ruling. Any more, Bren?
I believe we do have one that wanted a little more clarification on the COBRA, and as far as if someone is enrolled in the COBRA benefit under their FSA plan, Those who do still have a balance at the end of the plan year, and they are on COBRA, yes, they would be able to roll those funds forward. And keep in mind, there would be no COBRA premium associated with that rollover $500, as they would have already contributed all those funds in the prior plan year.
All right, and I think that's about it, plus we're out of time. So if we didn't get to your question, please submit them to us. We're more, if you didn't type one in, please submit it to us. You will get a copy of the questions that will be sent with the survey and with the link to the slides. We want to thank everyone for your time. We know how valuable and busy your time all is, your considerations. Thank you for considering the carryover, the grace period, and most importantly, thank you for working with Beneflex. We appreciate having each and every one of you as a client. Have a good day.